Medical Coding Fundamentals, Chapter 3, Guidelines, Part 1. The tabular list of disease is divided into 19 chapters. Most chapters will have a section at the beginning of the chapter that is devoted to the guidelines that help the coder. This chapter will discuss the guidelines for chapters 1 through 10. Infectious and parasitic diseases. This includes conditions such as HIV, human immunodeficiency virus, SIRS, systemic inflammatory response syndrome, and MRSA, methicillin-resistant Staphylococcus aureus. The guidelines for this section include the order of codes, what should be primary, what should be secondary, and combination codes. An example, HIV-related condition. Primary with related conditions following, or HIV positive but admitted for another condition, you're going to code the admitting condition first and HIV second. For asymptomatic HIV, you're going to use V08 as long as no other HIV-related conditions are present. Neoplasms. To code neoplasms, you're going to use the neoplasm table in Volume 2. It consists of 6 columns. Your primary malignant tumor, this is the original site of the tumor and the original tissue type. Secondary malignant tumor is a metastatic tumor, or the spread of a tumor from its original site to another location. Carcinoma in situ is a neoplasm that has not spread beyond the tissue of origin. Benign, not life-threatening. Uncertain behavior, not classifiable when the cells are examined. Or unspecified. There's no documentation to the nature of the neoplasm. Now, the guidelines that apply to this section, if documentation does not state malignant or benign, code as malignant primary. And you're also going to have order of codes. An example is treatment provided for the tumor. Malignancy is reported first. Radiation, chemo, and immunotherapies. Therapies are reported first. Tumor are reported second. Endocrine, nutritional, and metabolic diseases and immunity disorders. This includes conditions such as diabetes mellitus. In order to code diabetes mellitus, you must know the type of diabetes. Now you're going to use a 0 for your 5th digit for the type 2 or unspecified type, controlled or not identified as uncontrolled. 1 will be used for a type 1 juvenile type, controlled or not identified as uncontrolled. 2 will be used for a type 2 unspecified type, uncontrolled, and 3 will be used for a type 1 juvenile type, uncontrolled. Now, your secondary diabetes mellitus is caused by another primary condition or event. Guidelines in this section include 4th and 5th digit requirements, complications, manifestations, and the use of insulin. Diseases of the blood and blood-forming organs. This includes conditions such as anemias, coagulation defects, diseases of the white blood cells. And the guidelines in this section refer to the 5th digit to differentiate between anemia and chronic kidney disease, anemia in neoplastic disease, and anemia in other chronic diseases. And it also addresses underlying cause. Mental disorders. This includes conditions such as psychosis, neurotic disorders, personality disorders, non-psychotic mental disorders, and mental retardation. There are no specific guidelines for this chapter. Diseases of the nervous system and sense organs. This includes conditions such as pain, organic sleep disorder, ear and eye disorders. And in this section, guidelines only apply to pain. You must know if it is chronic or acute pain. And there's also combination codes that may be needed for the site of pain. Diseases of the circulatory system. This includes conditions such as hypertension, which is in a hypertension table, stroke, myocardial infarction. The guidelines pertain to the fifth digit and to classification of hypertension. It should not be as either malignant or benign unless it is supported by documentation. Diseases of the respiratory system. This includes conditions such as chronic obstructive pulmonary disease, asthma, respiratory failure, influenza, and the guidelines include how to code with the fifth digit, acute versus chronic, and the reporting order. Diseases of the digestive system. This includes conditions such as appendicitis, hernias of the abdominal cavity, diseases of the oral cavity, and guidelines. For this chapter, there are no specific guidelines associated with this chapter. Diseases of the genitourinary system. This includes conditions such as chronic kidney disease, or CKD, and ESRD, end-stage renal disease. Guidelines include the fourth digit of CKD to differentiate between the underlying stages of the CKD. Homework for this chapter. Read Chapter 3, complete using terminology, and checking your understanding for this chapter. See you next week.